Covaxin versus Covishield, a detailed comparison. The second phase of the COVID-19 vaccination drive has already begun in India, and many people are still unaware of how the two vaccines, Covaxin and Covishield, are different from each other. The second phase began on March 1, in which people over the age of 60 and those above 45 with associated comorbidities can take the life-saving shots. Currently, the government hasn't allowed people to decide which vaccine they want to get, but the result of the first phase clearly suggests that both the vaccines being inoculated in India are safe and effective. Well, we have compiled all the information to give you a better understanding of the formulation and every other detail about the vaccine you are going to get to stay safe from the coronavirus. Have a look. Covaxin has been developed by Hyderabad-based Bharat Biotech International Limited in association with the Indian Council of Medical Research, ICMR, and the National Institute of Virology, NIV. Covishield has been developed by the Oxford AstraZeneca and is being manufactured by the Serum Institute of India, SII. Type of vaccine: Covaxin is an inactivated vaccine, which has been prepared on a tried and tested platform of dead viruses. This vaccine is developed with whole virion inactivated virocell-derived technology. They contain inactivated viruses, which cannot infect a person but still can teach the immune system to prepare a defense mechanism against the active virus. These conventional vaccines have been in use for decades now. There are vaccines for some other diseases as well which are made using the same technology. These diseases are seasonal influenza, rabies, polio, pertussis and Japanese encephalitis. Covishield has been prepared using the viral vector platform, which is a totally different technology. A chimpanzee adenovirus, CH-ADOX1, has been modified to enable it to carry the COVID-19 spike protein into the cells of humans. Well, this cold virus is basically incapable of infecting the receiver but can very well teach the immune system to prepare a mechanism against such viruses. The exact technology was used to prepare vaccines for viruses like Ebola. There is no difference between the two vaccines in terms of dosage. Both of them follow a 2-dose regimen, administered 28 days apart. Storage guidelines: both Covishield and Covaxin can be stored at 2 to 8 degrees centigrade, which is a household refrigerator temperature. This makes both the vaccines most suited for Indian conditions, as most of the vaccines here are kept at the same temperature range. This also makes the transportation and storage of both vaccines easier. Both the vaccines have shown more than satisfactory results ever since the inoculation started in India. The effectiveness of the Covishield vaccine is nearly 90% as per the global reports, and Covaxin's 81% according to interim third phase trial results. Covishield, on the other hand, has shown a very satisfactory efficacy of 62%. Covaxin has been granted a restricted use authorization in clinical trial mode, while Covishield has been allowed for restricted use in emergency situations that can potentially prevent coronavirus infection in people aged 18 years and above. However, the Drugs Controller General of India, DGCI, has not given a market use authorization clearance to any of the vaccines till now. Price of the vaccines: both the vaccines are being inoculated free of cost at government health setups. The government has put a price capping of 250 rupees per dose for private hospitals and clinics. Mode of administration: both Covaxin and Covishield are intramuscular vaccines. Age of beneficiaries: Covishield has been approved for people aged 18 years and above, while Covaxin can be given to people aged 12 years and above. There, however, isn't any assurance if the vaccine can be given to children and pregnant women. At PharmEasy, we wanted to extend our support to the Government of India in its COVID vaccination drive. And thus, with our Go Corona Go initiative, we are offering a token of appreciation to every user who has got vaccinated. Basically, we're on the lookout for superheroes who will help make India COVID-free. For every vaccine taken by a citizen, we would be giving a flat 150 rupees PharmEasy cash in the wallet to the users that can be used on their next medicine order. Click here to get it now. The latest updates on the COVID vaccine. 164 million doses of the COVID vaccine have been given in India. More than 17 million people have received 2 doses of the vaccine and are considered fully vaccinated. Top health officials in India have stated that both Covaxin and Covishield are effective against the mutated UK/South Africa/Brazil virus. Sputnik V vaccine has been given emergency use authorization in India. In India, the Russian vaccine will be produced by Dr. Reddy's Laboratories. A recent study found no strong allergies caused by Sputnik V. India will produce 850 million doses of the Sputnik V vaccine every year. In terms of efficacy, Sputnik V outshines both Covishield and Covaxin with 91.6% effectiveness compared to Covishield's nearly 90%, global reports, and Covaxin's 81%, interim third phase trial results. Bharat Biotech will increase the production of Covaxin to 12 million doses a month. Sputnik will be the third vaccine to be used in India against coronavirus and will be delivered to India this month. The volume of Sputnik V vaccine production in India will be gradually increasing and may surpass 50 million doses per month. From May 1st onwards, everyone above the age of 18 years will be able to register for Covaxin and Covishield and Sputnik V when it arrives. With the start of the third phase of vaccination, vaccines can be purchased by state governments directly from the manufacturers. All the vaccine producers must sell 50% of their stock to the states through the free market. The remaining 50% will go to the central government. Now that all vaccines will be available in the open market, the vaccine manufacturers will also be able to decide the price of each dose of vaccine depending on demand and supply. The risk of contracting COVID after 2 doses of Covaxin or Covishield is minuscule. A study has found 0.03% of people caught COVID after the second dose of Covishield and 0.04% tested positive after the second dose of Covaxin.